I'm Joe Halco, your host, and welcome to another episode of NCSS Here for You. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously and strive to provide a continuum of the highest quality services to meet the needs of individuals who at any point seek assistance. This month's episode is titled NCSS Partnering with Schools to Support Youth. NCSS offers a portfolio of school-based services to local schools that address students struggling with mental health, social, emotional, and behavioral challenges, plus individuals diagnosed with autism spectrum disorder. NCSS staff work in tandem with school personnel to strive for positive outcomes for each student requiring professional assistance. To discuss the NCSS school-based services and our partnership with local schools in greater detail, I'm pleased to introduce this month's guest, Amy Irish, School-Based Services Program Manager for NCSS. Amy, welcome to the program.
Thanks, Joe.
It's great to see you. And by the way, congratulations, because I know that you were placed in this new role, was it about 4 months ago? Or
Yep, early in the spring.
About, yep. Okay. So let's begin, first of all, with how long has NCSS been providing the variety of school-based services throughout Franklin and Grand Isle counties?
Yeah. So NCSS has actually been partnering with our public schools for about 25 years. In 1992, the Vermont State Legislature moved forward some policy and legislation called the Success Beyond Six, which created both some fiscal opportunities, but also some policy to allow schools to partner with their designated mental health agency to pull those mental health services into their public schools. So that was in 1992. In the late 90s, the BI program started, was our first sort of go at that, of using that legislation to.
And for the viewer, BI?
Oh, behavior interventionist. Yep.
I'm only saying because we get very, very accustomed to acronyms.
Sure. Yeah.
However, there are many that don't have.
I'm sure there'll be a few.
So I'm sorry.
No, it's okay. So our behavior intervention program, which I'll describe a little bit later, came on board with schools in the late 90s. And then shortly following that was our clinical services, getting clinical services into those public schools. And then in about 2008, our school-based autism program came on board. And then most recently, we've worked with schools to create a new program called the School-Based Behavior Consultation Team, which pushes in across all levels of care in the schools.
And, what's the advantage to schools of partnering with NCSS?
Sure. There's a few. I think the obvious is, and probably the reason why people might first look to us, is those cost savings, leveraging those federal dollars to make those mental health services more available and more fiscally responsible in a school is an easy reason to partner with NCSS. But I think it actually goes beyond that. I would say the depth of supports that NCSS can bring to the table when partnering with schools, having multiple levels of people who have specific areas of expertise in the care that we're providing, depending on the service they're contracting for. And it's not just when you come into the BI program, you don't just get the behavior interventionist, but you have clinical supports behind that, a consultant, a team leader, and beyond, who are supporting that staff and that school and that family and that student in being successful, and has a variety of levels of expertise, but also just eyes on the programming to make sure it's really high quality programming. And then when the case is complex or we're not seeing the outcomes that we're hoping for based on our programming, we have the ability to lean into other providers at NCSS. Because it is a mental health agency, there are a lot of people who have areas of expertise for complex trauma or family systems, things that may not be the behavior intervention programs area. So being able to lean into them and to have a really high quality programming is obviously a reason to partner with NCSS for school-based, and that's an advantage. And the last piece that I think is really important that we probably don't talk about enough is I really believe that schools partnering with mental health services in the school is reducing the stigma of accessing mental health services. kids are and families tend to be a little bit more open to meeting them on their ground. And what we've actually seen from that is an increase in ability to refer to other services. So families come into a level of care in the school, in their community, and then we might be meeting with them and hearing the challenges that those families are having. And we might be able to say to them, like, we have other services that we might be able to support you. And we've done enough to reduce that stigma that families are a little more available to hearing about those and maybe accessing those supports that might be in a traditional model, because we've reduced that by being in their community. So I think those are real advantages for all of our community.
Yeah, and you're right. The whole stigma is so critical to break through that stigma so that people who are looking for mental health or behavioral services don't feel, first of all, they're the only ones, et cetera. You said something else, though, that I think some people might find counterintuitive, and I think it's very important that people understand, especially in light of school budgets and, you know, how everybody's trying to find ways to find cost savings.
Sure.
When you said that actually partnering with us on these programs saves the schools money,
Yep.
as opposed to spending more money. So I think a lot of people would find that a bit counterintuitive, like, why are you bringing this outside organization in? Won't that cost us more?
Exactly.
When the reality is it doesn't.
Yeah, that legislation really allowed schools to leverage federal funding that they otherwise wouldn't be able to leverage, so it can counter some of those costs of those more expensive services.
Yeah. And I just think that's important.
Yeah, I agree.
Because I think, again, to the average person viewing, they go, that can't be, you know, but anyway. Okay, so let's review these various school-based services that NCSS offers, and let's start first with, what does the Collaborative Achievement Team offer to students?
Sure. So the Collaborative Achievement Team is our intensive behavior intervention program, also known in the community as the CAT team. And that program offers intensive one-on-one behavior intervention supports for students in their public school who are experiencing pretty significant social, emotional, or behavioral challenges that's impeding their ability to be successful in their public school and potentially are at risk of losing that placement of being in a public school. So the CAP program comes in and assigns an intensive one-on-one who works with that student all day long, and they're embedded throughout their school day with programming that a board-certified behavior analyst has written, it's rooted in applied behavioral analysis, which is a fancy way of describing an evidence-based practice that uses what we know about human behavior to make significant behavior change in people. So that BI works one-on-one with that kid to implement that program and support the school and how they may respond differently, they may adjust their environment differently to make that kid build their skills. So it's teaching new behaviors, making sure some of those old challenging behaviors are no longer effective, and in the moment teaching, prompting, and supporting both the school and the student and ensuring that those kids are successful. And our ultimate goal is for those kids to be able to be transitioned down to our lower level and really accessing their education in their public school independently, because we wholeheartedly believe that kids should be accessing their education in the community that they're going to grow up in, because there's so many connections that are important that when kids have that positive experience in school, they're able to translate those into adulthood as well.
Yeah, absolutely. Now, how about the role that the NCSS school-based clinical program plays on the mental health issues that face certain students?
Yeah. So our school-based clinical program offers a school-based clinician or a homeschool coordinator that's actually embedded within the public school. So they're in that school all day in the system. Those clinicians can do clinical assessments as well as traditional therapy, which allows students experiencing mental health challenges to access that therapy in their public school as a part of their day, which reduces the barrier of transportation to try to get to a traditional outpatient setting. They're in their community at their school where they would be anyway, as well as just reducing the stigma. It's part of their day, it's part of their health and taking care of themselves. But beyond that, our clinical team is really dynamic, and they're working to push the mental health concepts into the entire system of the school. So those clinicians and homeschool coordinators are also working with families and schools at how do we help people understand things such as the complexities of trauma and how that can impact a kid's ability to access their education. And so teaching teachers to understand those complexities and how they might think about their kids' reaction or interaction differently in order to better support them in their education. as well as just looking at the entire system and making sure all the systems at schools, all kids come into contact with, are trauma informed and are really considering the many mental health challenges that our kids are facing today.
Yeah, and I'll interject post-pandemic, especially. I know that you've seen an increase.
Yeah,
without
absolutely.
question. So let's review the important role that the NCSS school-based behavior consultation program plays.
Yeah, so that's actually a newer program within our school-based services, and it was designed really out of an ask from a school of we've historically waited for students to have some really challenging behavior, some really complex mental health needs before we partner with mental health services. So we work together to talk about how do we build the capacity of the entire building. So instead of having an intensive intervention with one student, how do we look at the entire system in order to build their ability to support these complex needs that we see in our children today? That program does so by having a master's level person who's pursuing or is board certified in behavior analysis, so same evidence-based practices as our BI programs. But they are looking at really three scopes of their practice. One is instead of having intensive level need kids, we really work more on trying to get upstream, and we identify kids for a small caseload that does not need an intensive behavior intervention, but probably needs some skill building and some more connection with a safe, caring adult in their environment. And so that consultant develops a plan that teachers can implement that doesn't need an intensive intervention. But by doing so early, we're teaching skills that won't turn into more challenging problem behavior in the future, and doing it so early so they're skills that have become ingrained in the kid and they're really a part of their repertoire. And so just supporting those teachers as well, because we're asking them sometimes to do some pretty tricky things with kids, but we know if they work through some of those things, the outcomes will be vast. And it's sometimes just that support of that teacher of like, keep doing it. You're on the right train. This is hard and you can do it. And when they get through that with one individual kid, they often learn that they can apply it to their entire classroom, which is really an outcome that we didn't anticipate, but it's wonderful. The second component of that consultation team is looking more holistically at the school and how do we develop data systems so we're not just talking about what we think is a problem in the moment based on the last fire, but instead creating data systems in which we know what behavior should be managed in the classroom and creating consistent protocols for teachers to follow so that they feel supported and they have strategies to work with kids. But also to say, when it hits a certain level, how do we know when that kid should leave? What should the process be? How do we make sure that kid is coming back and we're repairing any harm that might have been done to the relationship or environment, but also using that data to create a team to review that data and make decisions, and not just admiring, oh, this has been a real challenge from such and such a kid this week, but instead to say, like, what are our next steps? Who are the people that we're going to pull in? What are the skills that are lagging? What are the interventions or the needs that aren't being addressed that we can address in different ways earlier on instead of waiting for it to become a large challenge. And those teams have been really successful. I'm always impressed by what they can come with, because it's not just NCSS sitting on that table. It is pulling all areas of the school into that, as well as building their universal systems that all kids come into contact with. Positive behavior intervention and supports, which is a statewide initiative. It's PBIS. Is something that we've helped schools get up and running and making sure they're doing it with fidelity, so that our interventions when working with kids are positive, because we know that building skills and being positive around what skills we want to see is the way to make long-term change for kids, not focusing on more of the punitive pieces. So we're really supporting schools on making sure that's a component. And then the third piece of that consultation team is really working in classrooms and talking about how do we set up environments that are supportive of all kids' needs, and how do we support just teachers' general knowledge of low-level behavior interventions or problem-solving some low-level tricky things and making sure they're feeling supported.
All important stuff. And I think that's interesting that actually was born out of an ask to us as opposed to us going to the table initially. So now, how has the NCSS school-based autism program assisted schools and individuals that are diagnosed with autism spectrum disorder?
Yeah. Well, the name actually is a little deceiving because the school-based autism program actually supports a variety of students. It is very similar to our CAT-BI program, except the student population that they serve is a little different. So they do provide supports to kids who are diagnosed with autism spectrum disorder, but they also provide those same supports to kids with complex medical conditions, genetic disorders, or Down syndrome and similar disabilities. So that population of students is a little bit broader than our name suggests.
Sure, yeah, because it's a lot of different types of developmental delays, not
Correct.
specifically.
Yeah, we've
sure.
actually lately been talking about shifting that name to be more reflective of the care we're providing. But that team does a lot of similar work to the BI program, using the elements of applied behavioral analysis to make socially significant behavior change to those students who are struggling with social, emotional, and behavioral challenges in the academic setting. And within that, they really work with schools to identify what are the learning goals for the student and how are we going to structure the environment that will support the student in being able to access their education. And another component that we've actually shifted to recently that has had really great results is sort of an add-on to the autism program, which is a community-based component. So the students who are accessing our autism program, if the schools elect, can also access our community program, in which schools are in their public school for a portion of their day, but we're really trying to promote inclusion and making sure they're maximizing access to their education, but also knowing that we want to translate some of those skills outside of the learning environment for these particular students. So that community-based program takes those academic goals and those math skills they're working on and translates them and generalizes them into more life skills. So making sure they're with other kids in that program, they're working on social skills, communication, self-advocacy, general living skills of cooking, cleaning, doing jobs, and making sure we're generalizing those academic goals and learning opportunities into the public setting, while also tackling those really challenging behaviors sometimes and ensuring students have the right level of support to be able to promote that independence that we're hoping for.
And that gets tricky because each situation is unique, extremely unique.
Yeah.
So, I mean, your staff, kudos to them because they really have to be able to, start from a ground zero, and everybody is a different, somebody, it might be light, it might be sound, whatever the situation might be, it's that it's not one size fits all when you're talking about these services.
Yeah, that team is so dynamic and has such an area of expertise. I'm always it's not my specific area, so I'm always impressed, especially when I've gone and seen some of the work and how creative they've been in working through some of these really challenging behaviors with kids. And they're doing so in the public too. It's not just, in a one classroom, one-on with a teacher and a student. Like they're traditionally a marginalized population. And I really believe that the work that program is doing is kind of bringing these kids into the light and enforcing them to be included in a much more meaningful way than maybe historically we have.
Yeah, and really trying to get everyone to live their best life for whatever that means for them.
Yeah.
And it's different.
Yep.
It's different. So. Now, in the years since you've been involved with the NCSS school-based services, what surprised you the most over the years that you've been involved?
Yeah, so I've been doing this work for NCSS for about 19 years, and I've had the luxury of working through a variety of these programs. And probably my biggest surprise is just people's willingness to be vulnerable and actual interest in trying to learn new things and help these kids. I have asked some adults to do some really hard, counterintuitive things at times to allow some things to happen that didn't feel good, but were able to trust the process, trust the expertise of we know this is uncomfortable, it doesn't feel like the right intervention, but it's about the future intervention. It's about what that kid's going to do tomorrow. And we know that if we do these things, research tells us this will be the outcome and these will be the shifts in the behavior that we really want to see. And I've had teachers just be really willing to do that and also take things on themselves. It probably shouldn't surprise me because I think teachers are incredible human beings in general, but just their willingness and their vulnerability and their interest in learning more, they're begging to understand more so that they can do their jobs better. And maybe it's surprise in the answer. Maybe I'm impressed by that. I think that's a really valuable thing that teachers bring to the table.
Yeah, and I think sometimes something that really gets overlooked when you talk about teacher, and let's again go back about 4 years or so, and how things dramatically changed when kids were trying to learn, either totally via Zoom
Yeah.
or other platform, and then in a hybrid setting, and all of those things that were so disruptive to. I felt so bad for the teachers because they had to be doing it on the fly just like
Yeah.
everybody else was.
Yeah.
But yet trying to maximize every single day to the best of their ability in what became a new world, so
Yeah.
to speak,
Absolutely.
educationally.
There's been a lot of pivoting in education the last couple of years.
And, I don't know if you remember, but some of the meetings that we would have during the pandemic where people would say, well, once we get past the pandemic, things are going to be great. And of course, everybody in the NCSS building said that's not true for the work that all of you do, because there's going to be a long, long runway afterwards to get everything back to quasi-normal.
Yeah.
And will it ever be?
Yeah, and during COVID, in large, our school-based programming didn't shut down in large.
Yeah, yeah.
We were engaging kids in the community because we knew that the importance of maintaining that clinical relationship in those interventions was so important in their long-term outcomes, even though we weren't really sure what was next. It was definitely a challenging but interesting time that we learned a lot. And honestly, the community-based program was born out of the pandemic, that was one of our ways in which we were trying to still meet kids' academic needs when schools were closed, that our most at-risk population, we tried to engage in services, and we did so through that community model, and it stuck, and schools liked it because the outcomes were really good. Families really liked it. Kids were making progress. So it was born out of such a chaotic time.
And you're right. That is it is so important that a lot of people, as everything was unfolding, they kept looking at all the negatives, and there were a lot. We understand that. But like in so many situations, from a negative, sometimes some positives come out of it because you're kind of forced to think outside the box.
Yep.
So, it is interesting how many different things have occurred due to what has changed since the pandemic as far as the services that we provide.
Yep.
So now, what do you see as long-term advantages to schools in partnering with NCSS?
Yeah, so I think there's a lot of advantages that we've talked about just on the level of care we can provide. But I think as far as the long term, one of the questions, because I've been doing this work in schools for such a long time, that people have asked me is why are you staying at NCSS? Why aren't you taking this work and doing it for schools? And the reason really is, I think in that long-term benefit is my answer. And that is, I believe that when schools partner with NCSS and contract with us to come provide those services in partnership with them, we create a space between the pressures of a school and the pressures of a mental health agency. Mm-hmm. So schools have so much pressure to get certain scores on tests to make sure these outcomes for kids are at a certain level. And when a kid has challenging behavior, that really makes it hard to meet those goals at times and can impact a school's ability to make choices in the short term, where we want to look at long term. And that contract creates some space. By working with us, we work for the school, but we don't have the direct pressures that the education system has. Although we honor them and we ensure that we're aligning with them, mm-hmm. we can make recommendations that might be uncomfortable or may take some talking into that would have been really quickly taken off the table if you worked for a traditional school setting. Sure. Just because I don't work for the school, I can push back a little bit and have some of those uncomfortable conversations. And that comes across all of our programs. We're allowed to kind of pause some of those pressures to support that individual kid, that family, to be that liaison if there has been harm to the relationship between schools and family, or maybe that parent had a challenging educational experience themselves and they're bringing that in. Yeah. And not everyone was a doctor in their life, but everyone's been to school, right?
Yeah.
So you have an experience that you bring with you. And if it wasn't a good one, then you're going to push back on some things, especially when your kid is struggling and,
Sure.
and having a hard time. So I think we find that families are often more willing to push back on schools than they might a doctor, right? Because mm-hmm. they haven't been a doctor, but they've been in school. And so we can be that liaison and we can create that space to make really good choices that are well thought out, maybe aren't the most popular in the moment, but we can look at the big picture because we understand how it will impact the big picture. So that's probably the first half of my answer. And the second half is just the immense amount of expertise and care that NCSS can bring to the table. that when I am stuck with a complex case and I'm a supervisor to a supervisor, I can then turn to someone and say, like, I don't understand why this kid is presenting this way or not responding to my intervention this way. What are your thoughts? We have an entire consult program that's for sexualized behavior and complex traumas that we can bring cases to and present them to these people with an incredible wealth of knowledge to talk about things that we maybe don't know about or interventions that are newer to us. And they can really support us with some things that I would never have thought of, as well as our outpatient team, or if we have a family systems challenge, I can go to our home and community team and I can say, like, I'm stuck, this family is stuck, what do we do? And I just think that is such a long-term advantage of being able to do that and get that expertise, but also be able to partner and maybe have those services wrapped around a kid and a family in a way that's really holistic. And I'm really proud of the work that NCSS has been able to do when they're partnering with schools who are they've been incredible to work with.
You know, and you in mentioning what you have, it really gets down to, you know, organizations working with other organizations that have expertise in an area. And as you said, that can look at something and bring something that might be a little more difficult maybe to hear, but coming at it professionally and saying, this is what we believe. And you're right, the entire network within the organization that you can lean on, not to mention from supervisory, supervision, as well as others throughout the organization that can bring maybe a different outlook to a challenging circumstance. You wouldn't have that if you were, within the confines of, the school was the total group dealing with
right. And
all
I don't
those
want to minimize
circumstances.
their role either. Like,
No,
I think
no.
honestly, the fact that we come from different areas, it creates a lot of creative thinking and pushback. Like, it's not just like the NCSS comes in and says, this is what's happening. It's an interaction, and we create such really out of the box things that I don't think, like you said, would happen if it was just one entity making those decisions.
Yeah, I think, the work that your teams does is extraordinary. And I think the partnering with schools, and I would say to any school that for any reason has felt, should we really work with NCSS, that they really need to consider all the benefits of collaborating and partnering together for the good of the student and their families. And we can't forget about the family aspect as well. You have the student at the center, but it's certainly the family as well. So, kudos to you and your teams, And with that, our time is up. So I want to thank my guest, Amy Irish, for sharing her insights on the NCSS School-Based Services Program, partnering with schools, and the impact on the lives of young students. I also want to thank you, the viewer, for spending time with us again this month. You can learn more about NCSS and all of our programs and services by logging on to ncssinc.org. I'm Joe Halco, and I'll be back next month with another episode of NCSS Here for You.